On one of our previous videos, Sarah BB235 asked if I could please do an explanation about why I got porcelain veneers. So Sarah, this one's for you. I have porcelain veneers on these two teeth, the laterals. And the reason I have them is because my teeth formed very small. In my family, there's an incredibly strong inherited trait called peg laterals. And what that means is that the side two teeth form too small. They are pegs. And actually it can manifest itself as the trait goes down through the family as actually having missing laterals. It's so strongly inherited that if your parents have 4 children, then statistically half of them will have some manifestation of the trait. They may have one lateral that's too small, they may have both laterals that are too small, or they may be missing one or more of those teeth. And so in my family, my dad has it. He's completely missing those 2 teeth. I have 3 siblings, and 2 of us have peg laterals. I have 3 children, and 2 of them have peg laterals. So lucky that there's a dentist in the family with that much damage going through the genetic pool. So not only do I have veneers on my laterals, which you can get really close and see, you can't even tell that it's this one and this one. But my daughter also has peg laterals. So you can see, isn't she the cutest little munchkin here? Very early on, I think she was about 4 or 5 in this picture, maybe 5 or 6 actually. We started to see her permanent teeth coming in, and we could tell that there was going to be a problem. So what we decided to do was early intervention orthodontics on her. And very early on, we started to develop the growth of her jaw using appliances like removable retainers and also braces to start to arrange her teeth so that although the teeth were small, we started to put them in the middle of the space where the tooth should be. One of the mistakes we see being done across the board still today is dentists and orthodontists squeezing all the teeth together. And if the teeth are too small and you squeeze them together and close all those spaces, what you're doing is crowding the tongue towards the back of the mouth and unintentionally creating somebody who might have snoring or sleep apnea problems later. So here's Antonia as she grew up. And so here she is after we finished the intervention with the orthodontics, the retainers and the braces. And now you can see that there's gaps between her teeth, but the arch form, the way the teeth are arranged in her arch is beautiful. And you can still see that some more intervention was needed because from here to here, her bite is still, it's a little too short. She's a little too mushed. So we finished that with some more intervention. And then once everything was all developed properly, in this picture, guess what she got? Porcelain veneers. Some people might say that it's a little early to do porcelain on a 12-year-old little girl. But my feeling on that, sorry about the ringing phone, my feeling on that is that it's never too early to do that because there's a defect, a developmental defect there, and we're restoring it back to normal. We did not prepare her teeth at all. They're already little, so there's no reason to take away any enamel. The porcelain veneers simply slipped right over the peg lateral and completely restored her mouth. I would much rather send a girl into the difficult preteen and teen years with this smile than this smile. This one, I can already imagine how she would be teased, asked if she still has her baby teeth in. So anyway, that's how we handle the problem in my family. My dad, my sister, and I all have, and my daughter, all have porcelain veneers to restore the problem. Now you may be asking, I mentioned I had 2 kids with the issue. Well, the other one was blessed with all the other teeth were a little bit too big. And so aesthetically, I don't think that we're going to need to do porcelain on her. So we'll see. It's lucky that their mom is a dentist, like I said. And last and most importantly, can I just say, go Hawks!